Do you know what hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe you have hypertension, and I've been taking care of that for a long time.
Hypered? Mm-hmm. Hypered?
Like you're hyper? Mm-hmm. What does being hyper mean to you?
That's where you can't be still. You always got to be doing something.
Do you think I think you're hyper and have hypertension?
I don't know. That's what I consider it.
Okay.
Being, you know.
Okay. But you know you have high blood pressure.
Mm-hmm.
Okay. But hypertension doesn't mean the same to you.
Mm-hmm.
So if I ask you if you have hypertension, you're going to just think I think you're jumping around on the chair or something like that. Something different.
Just being hypered, you know.
Okay. All right. Well, I haven't done a very good job teaching you what hypertension is, because I think you take that medicine for your hypertension, and that's one of the things that I try to work with you on is your blood pressure. And high blood pressure and hypertension, to us, is the same thing.
The same thing.
Yeah.
Low health literacy impacts patients and all aspects of the healthcare system in many ways. In financial terms, patients with low health literacy use healthcare services more often and increase healthcare costs by an estimated $50 to $73 billion every year. The cost to patients can be equally high.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, "We can repair that." Great! I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at a hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, "Excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words." To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign. Never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, "How are you feeling since your hysterectomy?" Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part in my body, and I didn't know it?
A patient signs a consent form that they don't understand. They undergo a procedure and there's an adverse outcome that might have been one of the risks. There are legal cases clearly showing that these individuals can sue successfully in this setting because they did not give informed consent.